welcome everybody to this podcast on Health Devolution. I'm Sharon Driver. I work for Visions4Health. We're a healthcare network agency who enable mutually beneficial dialogue between the NHS and the healthcare industry in order to improve commissioning and services for patients. We've had a lot of questions around health devolution, so we've put together some information for people in the NHS and people in the healthcare industry who are trying to understand the direction of travel. Before we start to look at some of our findings on the health devolution agenda, let's start by covering off some of the basics. So, first of all, what is devolution? Now, devolution politically is all about the transfer of power between a central government and a lower level of government, like a local authority. But that's not really what's happening so much in healthcare, because NHS will remain accountable under the current system for healthcare. So in many ways, the word devolution isn't quite accurate when it comes to healthcare, and really it's more about being a form of decentralisation or delegation. But if we look at what's attractive about devolving aspects of healthcare, I think most people understand now that in reality, the ability of the NHS to influence healthcare is fairly minimal when you consider the impact of other areas like housing or employment on people's health. So devolving healthcare is really about bringing those together as an opportunity to make improvements elsewhere within the infrastructure that will therefore have an impact on healthcare. But more specifically, if we look at the potential benefits of devolution, then what's well known and recognised is that individuals in a lower socio-economic status tend to have poorer health outcomes. And actually things like being employed in good jobs, with having a reliable income, have a significant contribution to individuals' mental and physical health. The devolution agenda is about driving forward local economic growth in a way that improves the prosperity of the population locally and therefore improves health outcomes. So devolution to local authorities is very much about taking control of public services in an area to drive that prosperity. And what we will start to see is local leaders trying to legitimise taking greater control of the power at a local level to ensure that public services are improved in a way that will impact on the health of the population. So when you look at what's happening in the devolution agenda more broadly, there's far more focus on things like housing and transport and other sectors like that will actually prevent disease from occurring in the first place, and those that promote well-being. If you are interested in knowing more or accessing this podcast again, please go to our Networks for Health link, which is networksforhealth.ning.com, or email my colleague Sarah at Visions4Health, and we'll be happy to pass the extra information on to you. Thank you for listening, and do look out for future podcasts from Visions4Health. Bye for now.